Everyone, this is Dr. Chiang. He is currently the assistant professor of medicine out of the Sidney Kimmel Medical Center, which is located in Thomas Jefferson University up in Philadelphia. At Thomas Jefferson University Hospital, he is the chief of bariatric endoscopy, and he's also one of the few. He has one of the few people in the country that has the role of being the chief social media officer for the hospital as well. Prior to that, he started his education down at Duke for his bachelor's degree, then went up to Columbia University where he got his medical degree, stayed there to do his internal medicine residency. Eventually, he moved up to Boston to join the Brigham Hospital to do his general GI fellowship, and then stayed on actually to do a year of bariatric training with Dr. Christopher Thompson, one of the pioneers in that field currently. And after that, made his way down to Philadelphia to do his advanced endoscopy training at Thomas Jefferson University Hospital. Dr. Chiang has extensive research in bariatrics, advanced endoscopy, but what he's going to talk to us about today is the evolving role of social media, both in our how we interact with one another. If the pandemic has taught us anything, it's obviously we needed to kind of rethink how we all connect with one another when we can't be all in the same place at the same time for big meetings, but also how we use it as a tool to teach one another, to teach our students, but also to educate our patients. His social media presence, one of his early initiatives was, looking at verifying healthcare and information sources on social media, and through works like that and continuing efforts as well as publications to look at the quality of information available to people on the internet and whether or not it actually coincides with what the science shows. So we're really, on behalf of Dr. Haddad, my chair, as well as our entire GI department, we're really happy he could join us from Philadelphia and talk with you all today. So Dr. Chiang.
Thank you so much for that introduction. Sorry to keep everybody waiting, and welcome to anyone who is just starting out since it's July 1st. So it's an honor to be here, for the new medical year. I'm going to be speaking, as Joe mentioned, about social media and the health professional. And I'm going to tell you a little bit about my journey and all the different, risks and benefits to using social media, in my opinion, and what I've learned through the years. These are my disclosures, most relevant of which are TikTok and W2O, which is a marketing firm. And so I'm going to begin by giving a kind of overview of the landscape of social media today. Once again, my motivation and journey through social media, and then a little bit about GI and social media specifically, and kind of how I apply social media and how it's become a part of my job in a lot of ways. So I think it goes without saying that social media has a significant impact on our social political landscape, but we may not think of social media as, and its applications in other ways, especially when it comes to healthcare. So I think often in years past, I think now there's a greater recognition of the influence of social media on, various sectors. But I think many still associate social media with selfie culture and kind of personal use and sharing, among your own friends. So we often think of, the leftmost panel here. Over the past several years, we certainly have seen more of it being kind of in the whole conversation when it comes to politics, and also just having a role in sparking cultural revolutions and whatnot. But then on the right-hand side here, this is an example of a company group that promotes products that aren't necessarily evidence-based, and could potentially, lead to harm as well. It's notorious for that, and it's certainly not the only one out there. So it's just one example of many. But if we think about social media, even among influencer circles, and kind of how we often associate social media with celebrities and public figures, many have used social media in a productive way to build their businesses, to really, connect with a greater audience. Similarly, our official agencies out there like the CDC and HHS have used social media to communicate with the greater population in general, and also our societies, professional societies, and medical journals as well. So this is a screenshot, I think, from a a while back over here on the right-hand side of the New England Journal of Medicine. And when they first started on Instagram, or when I first came across their page a couple of years ago, they had just started and had very quickly amassed a large following. And I was very encouraged to see that many people were actually following that account, knowing that, you know, it's a legitimate source of medical information. And I was also very pleased to see that they were presenting the information in a way that was very digestible and very aesthetically kind of curated. So clearly whoever is running their content knows what they're doing, and I think they're doing a really good job. So again, major journals are taking advantage of social media. Thought leaders and our colleagues are taking advantage of social media as well. You know, leaders not only within the academic circle, but also, you know, in more regulatory roles. And then patients as well. I think we need to remember that you know, patients at the end of the day are exposed to so much information online. And more importantly, they're also finding community on social media. So this is an old screenshot from Instagram as well of this hashtag WLS community, which stands for weight loss surgery community. And when I showed a lot of my colleagues, bariatric surgeons, for instance, they had no idea that patients were, you know, using these hashtags, finding one another, communicating with one another, and sharing their progress, sharing their concerns, and finding support, you know, on social media. The latest figures from earlier this year, January 2021, show that, you know, with every passing year, there's a greater and greater adoption of social media over time. So chances are everyone on here is probably using social media, whether or not you know it. And it's kind of loosely defined as a lot of the popular apps that we know of, right? Instagram, Twitter, whatnot, but also the crowdsourcing websites, I think in some ways fall into this scope as well. You know, whether we're searching on Google and going onto Wikipedia, and or even for our personal use, like going on Yelp or something like that. So chances are you are already engaging with social media in one way or another. And the data shows that everyone spends a significant amount of time on social media every day. On average, 2 hours and 25 minutes a day are spent on social media. And if we compare that amount of time, you know, from a patient perspective to the amount of time that's spent directly interacting with one of us in the clinical setting, we can see that, you know, day after day, it's a lot more time spent on social media or the internet in general. So, you know, that's an opportunity potentially for us to utilize that time that they're spending on the internet to convey some of the messaging that we'd like them to learn about. And just to give you a sense of the world's most used social media platforms, I think we all probably know that the #1 most widely used social media platform out there is Facebook. #2 is YouTube, which is also considered the second largest search engine after Google, despite the fact that it's also owned by Google. WhatsApp, Facebook Messenger, Instagram, TikTok, and then further down, you know, Pinterest, Twitter, etc. I think that we, you know, with every passing year, these trends shift, and who knows in a couple of years what the next big social media platform is going to be, which ones are going to become more popular, which ones are going to drop off. But it kind of, you know, would benefit us to understand where patients are spending the most time, or where the general public, I should say, is spending their most of their time on social media. And clearly the numbers don't lie. There are, you know, billions of people using these platforms each. You know, Instagram, for instance, over 1 billion people, Facebook, over 2 billion people. Here in the US, more and more adults, we see the greatest number of adults using YouTube, with Facebook as a close second. And I think these are also numbers from this year. So again, I think that although Facebook was previously #1, I think we're seeing trends change. And every platform kind of always captures a different audience as well by age group. And we see here that the age group, like for Snapchat, for instance, spans a very wide age range, although very few, a small percentage use Snapchat, a greater percentage a small percentage of age over 65 use Snapchat versus a younger group here. But it's just good to know that, we're potentially capturing different audiences with each social media platform. And likewise, not just age, but by other, demographics here, by race, by kind of socioeconomic status, education. There are different platforms that different groups may gravitate to, which might be important to know if we want to target certain audiences for our messaging. This is just an interesting distribution showing that, across all age groups now, a significant proportion of people are using social media for work. I believe the next slide shows that when we think about the primary reasons why people use social media, I think in the past we may have thought of it as a leisure, for leisurely use, but the number one reason that people cite nowadays is to stay up to date with the news and current events. And I think that health-related news, especially with the pandemic this past year, falls into this category as well. So again, this is not just for fun, but it's actually a way that people are using social media to educate themselves. So I want to go into kind of my journey a little bit and tell you how I got into it, because maybe some of you are considering getting into social media and have the same motivations and may share a similar passion. But very early on in training, I recognized how patients weren't getting their medical information or medical knowledge from our brief clinical encounters, but rather from the media they were being exposed to outside of the hospital. So I took it upon myself during residency, and if there are any residents here, you may be interested in this sort of a program. But I spent some time at ABC News learning how the medical news was being vetted before it would end up on World News Tonight or Good Morning America or whatever program that they have running. And in that process, they were using Twitter at the time to host weekly chats online about various health topics. And I don't know if these chats still are happening, but it really gave me much greater insight into how social media could be used to foster productive conversations. And so I made the conscious decision to transform my personal Twitter presence from a personal one to a professional one. Then I started taking that idea and tried to, at the time, start a division account for the division where I was training at the Brigham. Ran into a lot of red tape. So in a way, to justify the time that I was spending on social media and trying to justify the need for this type of a social media account, I started doing social media related research. And that's what really got me kind of transformed it into a more academic interest. And I started being a part of various committees on all the kind of professional societies within my field. And one step led to the next. And I then became Chief Medical Social Media Officer here at Jefferson when I started my first faculty position here. And I'll get into that in a little more. And also similarly on the different social media platforms, not only started using Twitter, but then after a couple of years, made the shift from personal to professional on Instagram, then YouTube, TikTok, and virtually every major platform out there I've tried to keep up with and at least tried to learn exactly kind of how the platform works and what exactly we can do to use those platforms to spread good health information. So again, what motivated me was that meeting patients where medical information is encountered and where health knowledge is sought. Like I said earlier, it's social media, the number one use now is staying up to date with current events, being an accurate source of health information. So, often when we think about our institutions, the people who are putting out the social media content for our hospitals are not necessarily physicians or health professionals, they're communications professionals. But, really when we're talking about areas, topics within our own our areas of specialty, it'd be best if it was one of us who, was trained in this, in those areas. So I felt like I could serve as the most accurate source of health information in my specialty. I could also highlight a less visible area of medicine, especially when it comes to not only advanced endoscopy, but also bariatric endoscopy. I think it's not very well known within my own professional field, let alone the general public. So I could speak on a less visible area of medicine, especially because this is not an area that is very well funded, relatively speaking, compared to some other kind of conditions out there that are very well funded by, pharma, et cetera. Over the years, I've also recognized how it's an opportunity to humanize the profession as well and bring myself closer to patients, because I know from personal experience, growing up, I felt that doctors were unapproachable, intimidating at times, and I'm sure others feel the same way. So being able to showcase the fact that we have this similar struggles and similar interests and questions, especially when it comes to the pandemic, could be very helpful in building trust, especially when trust is at an all-time low in health professionals at the moment. And finally, advocacy and social justice. I think that we have, again, an opportunity to speak out about certain issues and have have a platform to advocate for certain issues that we're passionate about. So when it comes to medical misinformation, I spoke or I pointed out very briefly that company earlier that promotes certain products. And similarly, this is a screenshot from this individual who has over 3 million followers on Instagram, and basically will pair any fruit or vegetable with any random condition and say that one treats the other with no evidence behind it. And he even says on his bio on his website that he gets his medical information from conversing with a spirit of compassion. So clearly it's not evidence-based, yet he has a tremendous number of followers that are really buying into what he has to say. And in and of itself, these fruits and vegetables aren't dangerous. But if someone is going to take this advice and substitute their actual treatment plan with these home remedies, that's when we're potentially going to run into problems. And I don't know if any of you have witnessed this before, but in my training or throughout the years, I've certainly seen some people substitute the treatment that we recommend with whatever they're reading on the internet. So this is something that we need to be really aware of. So again, just to recap, erroneous information is easily perpetuated on social media. Clinicians need to be on social media to be heard or risk having their narrative told by others. And clinicians also need incentives to participate in public dialogue, which is something that I think we're all working on. Many institutions are also kind of slowly integrating social media use into the tenure and promotion structure as well. Certainly not the only thing that determines it, but having a presence, being involved in public health messaging is just as important as publishing papers. And we're in some ways, what the pandemic has really highlighted is that we're expected to communicate with our community. We're expected to be a beacon of public health, but at the same time, we have very little incentive to do so, and we don't have the training to do so. Through med school, I don't know how many of you had any sort of marketing or communications or PR training going through medical training, and yet we're expected to be effective communicators. And I think that there's clearly a gap there that we need to address. So exactly, communication in the digital age is not taught enough in medical school. And clinicians also need guidance on how to responsibly and effectively use social media to prevent further erosion of trust in healthcare. So that's really been a big motivation for me, is how can I help others understand the value of social media, but also not just jump in head first without recognizing all the potential pitfalls, because there are a lot. but and hopefully you'll be able to take away a little bit of my experience with you from this talk. So if you aren't convinced enough yet to use social media professionally, I think for you, there are a couple of benefits to be aware of. Staying ahead and being notified in real time of journals, society news, of news in general in your field. You know, nowadays, I don't wait for the journal articles to show or the journal to show up in my mailbox. I get those updates from social media. You don't want to miss out on the online conversation. I think that when I started on social media 8-9 years ago at this point, professionally, there were very few physicians in my field, probably 5 or so. And now there is an entire network on Twitter, for instance, of hundreds of gastroenterologists. And there's a constant conversation about various topics, some of which are, gray areas that are not well investigated, and opportunities for research are, it's a tremendous opportunity for research because there are these sort of productive conversations happening. And likewise, networking with peers and leaders in your field. I think, people are more accessible than ever, for better or for worse. But I think that especially for those of you who are still in training, it's a great way to potentially, get to know some of the some future mentors or other people who or communicate with people who you might be inspired by. Now, for others, again, patients, first and foremost, it's a way to educate patients or the general public on various health topics, but it's also potentially a way to recruit patients as well for certain clinical trials or studies if it's into the IRB. So I'm seeing more and more studies recruiting patients on social media these days, which I think is a great way to reach an audience that previously might not be aware that these studies exist. Combating physician rating websites, 99% of what people see on Google is from the first page of Google, and we all know those pesky physician rating websites. So if you're able to build up your digital presence, potentially, what you might not want people to see can be pushed to the second page of Google, where people aren't quite as often on. And indirectly boosting your institutional reputation. The more active academic, physicians there are on social media, the more people will see that, oh, maybe your institution is doing something really cool and doing something very innovative, because really that's where a lot of these ideas are coming out of, our academic institutions like yours and mine. So boosting your institutional reputation, I think, is another indirect benefit of using social media. And finally, humanizing the profession. And I see that, even from at the most granular level, patients who have seen me on social media and have come in to see me for their own conditions, really, I think, have not only a better bond with me, but also a sense of loyalty. I feel like retaining patients is always a concern at the institutional level. And so this is one way to kind of build loyalty to the practice. And in terms of which social media platform to use, I think that over the years we've seen different niches for each social media platform. And when it comes to the medical field, Twitter really is the prime social media platform, where they're probably the most health professionals actively involved in academic discussion. So if there's any platform that I would recommend people to get started on, it would be Twitter. It's also probably the easiest to use of all of them because it's text-based. So I think that that's probably the barrier to entry is lowest with Twitter. But each platform, in my opinion, serves a different purpose and a different audience. So Twitter may be the best for reaching an academic audience to network with your colleagues. But in terms of reaching the general public, other platforms might be better. Instagram, TikTok, for instance. And one example is the way that these platforms are built. So if you think about those of you who are familiar with Twitter or Instagram, the people who come across your content are people who already follow you on these platforms. But other platforms like YouTube, where people are searching information, where it's more easily searchable, they may come across your content more readily without having followed you beforehand. And likewise for TikTok, if you know the platform, the main feed consists of people who you don't necessarily follow. As long as your content is engaging or interesting or entertaining, if people engage with that video, that piece of content, it has the potential to go viral and reach millions and millions of people. And as a result, I've been able to, it's not always successful, but when I have a very compelling story or some very interesting way that I've presented a piece of content, that has gone viral a number of times. And as a result, on TikTok, cumulatively, I've had over 120 million views, and that's a lot of eyes, and that's a lot of people who may be learning from that type of the videos that I'm putting out on there. I think that one thing to point out eventually, this is not necessarily a beginner level type of consideration, but for every platform, there is kind of a look and feel to it. And we're not used to thinking in this way as health professionals, but ultimately, if you're going to use social media professionally, you have to think of yourself as almost like a brand. That if there's going to be, if patients are going to, or the general public are going to look at you and think of you as the authority on a certain topic, it should be kind of an identifiable brand, an identifiable pattern. And so aesthetically speaking, I try to conform to a certain pattern on each platform. And that may sound very confusing to you, but if you look at YouTube, for instance, those of you who use YouTube frequently, you may notice that these thumbnails really take, there is a kind of, not a formula, but a strategy to trying to make thumbnails most engaging so that people will actually notice it and click into it in the first place. And I think that these are the types of things that we don't necessarily think of, that other people, other industries are using on a daily basis to try to capture our attention. And we have to do the same thing. If we're going to try to get people to learn about health, we kind of have to, in some ways, trick people into making it more entertaining, or making it like something that they would be interested in. If we're just out there presenting data and numbers and text, that might not be the best way to convey information or capture someone's attention. I'm going to humble brag a little bit, because aside from some of the other benefits that I mentioned already, I've also mentioned the potential to advocate and really take this to another level. So I've been able to advocate on a variety of different issues, not only medical misinformation, but also advocacy for social justice issues and LGBTQ related issues as well. Was nominated for a GLAAD Media Award this year. Have collaborated with various really important kind of suicide prevention groups for the LGBTQ youth community, like the Trevor Project. I spoke to Health and Human Services in DC last year about social media and vaccines. This is pre-COVID. And I think that this is something that potentially, is just to demonstrate that what we can do on social media can potentially lead to even bigger opportunities and bigger things, hopefully more impactful, maybe one day even impacting legislation. So when we think about social media, again, yes, everything that I do on social media is in my downtime, apart from my clinical job, but it's no less academic, in my opinion. I not only have a position with my institution now, I serve on various committees and task forces currently, and in the past, virtually every single GI society I've been involved with. And I've also founded my own nonprofit professional society, the Association for Healthcare Social Media, which aims to help health professionals use social media exactly what I said earlier, responsibly and effectively, and provide resources. And I believe I have a slide on it a little bit later, kind of going more in depth about that. For those of you who are curious about my role here as Chief Medical Social Media Officer, I think there's often this misconception that I was given this role just because I have a large following on a certain platform. But I think that, you know, one thing is I'm active on multiple platforms. I'm an experienced user. I'm well connected within the online communities, and I am public health trained. I do research in social media, and now I have relationships with the social media platforms, and have, you know, can address some of the concerns that we have on social media directly with them. But my role here at Jefferson is not just kind of a what this role really entails is educating on the risks and benefits of social media. So I'm a liaison between the clinicians and the media relations team. I directly help out with the campaigns here that are being put out through our institution. I revise and update the social media policy, and of course encourage everyone here to use social media. So I mention all of this because I don't think I should be the only one. Currently, there's only one Chief Medical Social Media Officer in the country. There are similar roles here and there, often not held by physicians, but I shouldn't be the only one out there, is what I'm saying. I think that every institution ultimately should have someone like me who's a health professional, also active on social media, who can speak to the importance of social media. And I really think after this past year with the pandemic, we all recognize how social media can really impact public health. I'm just going to point out a couple research projects related to this because I think that this can potentially be replicated in non-GI fields as well. One of the earliest things that I did was coming up with a standard list of hashtags where academic discussion can be had on social media. And I was not the first to do this. Oncology has done this, cardiology has done this, urology, I believe, has done it. There are a couple other fields as well. But I did it for GI, and the way I went about it was I convened all the GI societies at the time on social media that were on social media. There are now many more on social media now, and also all the journals at the time that were active on social media. And we came up with a standardized list of hashtags for various conditions within our field so that we could have a standard academic discussion about them, so that, you know, if you ever were curious about something, you knew which hashtag to use. So there was that. It's called a hashtag ontology. So if you ever want to search the hashtag ontology, you can Google that. One other thing that I looked into was the association between social media involvement by the institution and divisional rankings. And I think part of the reason why this was undertaken, as I alluded to earlier, was to try to justify why it's important to have a social media account for our division. And I saw, you know, through this project, basically was able to identify a correlation there, and certainly not causation, but, you know, but helpful to understand that, you know, even over time, increase in following potentially could predict an improvement or a maintenance of the ranking compared to other kind of parameters that we looked at. I've also looked into social media perceptions by program leadership, you know, when it comes to training programs. And over the years, we see kind of this trend towards greater acceptance of social media as an educational tool, as a source of medical information, and also in using social media to potentially vet applicants. And this is something that we all should keep in mind because, again, if you have a public social media account, or even a private one for that matter, it could potentially be viewed and could sway the perception of, you know, applicants. So this is something that I tell, you know, trainees as they're applying to whatever next phase they're applying to, because it could directly impact their candidacy. And identifying online deficiencies in our literature. You know, I've looked at how our medical journals have distributed their content and which areas within our field are underrepresented and what types of papers are underrepresented, and not only which topics but what types. Obviously guidelines and systematic reviews and meta-analyses are most often looked at, but there's other things that we could probably focus on as well. So just identifying gaps in our understanding within our field and how we potentially can help address that. I've also looked at patterns of social media use at our various GI conferences, and noted that ultimately, even though there's been a growing number of users online and also the number of tweets as a result, this was on Twitter, we might not be reaching more people because the impressions per tweet and tweets per participant were not changed over time. So just these projects just give us a better understanding of how we're using social media in our field. And assessing misinformation, I think this is probably the most tangible type of research related to social media that I've been doing. And we're looking at, for instance, most recently, we took the top viewed videos on YouTube when you search colonoscopy. And these are videos with over 250,000 views. And we looked at which ones were factually accurate or inaccurate, and very concerningly noted that there are more inaccurate videos than there are accurate videos. And there are even videos out there that you are not only just inaccurate, but just downright harmful, and saying that colonoscopies are dangerous. And these are often videos made by non-health professionals who are trying to promote other kind of holistic approaches or things that that really are not evidence-based. So it goes to show that we should all probably be we need more health professionals on all the different social media platforms, because there are a lot of other people out there who are creating content that are directly impacting our practices and our patients, I should say. And this is just the data. I'm not going to belabor you with all the numbers here. There have also been other studies done by my colleagues on patient engagement on social media, and the fact that patients may not be very vocal on social media all the time, but they're silently engaging, and they're reading what you're saying, and they're liking and retweeting and saving the content. I definitely have gotten private messages from patients saying that because of something they've read that I've put out there, they went back and told their family and gotten their entire family screened for colon cancer, for instance. And I think those are the moments that really make me feel like what I'm doing on there is worthwhile. And so at the end of the day, it can be very rewarding. Others have looked at again, deficiencies in how we're addressing some patient concerns based on what they're saying on social media. And so in order to develop some IBD educational videos, they've looked at how patients want to know more about self-advocating and staying healthy outside of just the medical recommendations that we give them, and things that we don't necessarily think about. And I think that we can use social media to glean more about what patients are actually concerned about and address those concerns. How to get started, especially in my field, I think it's been really fantastic that almost on a daily basis, there are structured, scheduled chats online. And maybe this is something that exists in other fields as well now, especially with the pandemic and everything going virtual. But not only are there structured chats about various topics, here we have there's one day that's devoted to advanced endoscopy, one day that's devoted to motility, and other types of conversations. But there's even certain chats that have CME credit that can be awarded with those chats, with participating in those chats, which I think is really novel. So kudos to some of my colleagues who've been able to do that. And hopefully, we'll see more and more of these, so that, again, that time that is spent, we all have a limited number of hours each day to spend on learning, that you get credit for that. So for those of you who are curious in how to get started, you don't have to jump right in and make mistakes as you go along. You can observe first. I think that with every new platform that I use, I try to observe a little bit and get an idea of how others are using the platform before I get started. And also ask yourself what your strengths are. You don't have to necessarily use all the different have a presence on every single platform. I certainly try to do that, but that's this is something that I've done over many, many years. I would try to identify your own strengths. Are you great in on camera? Are you somebody who likes to create videos, who's great at editing videos? That might drive you more towards YouTube or TikTok rather than something that's more text-based like Instagram. Or Twitter, I should say. So, identifying your own strengths, being honest with yourself, because if it's not something that you genuinely are interested in doing, you're not going to be able to sustain it. And I think what's worse than not having a social media presence at all is having one that's inactive and just sitting there. And so people who come across your page will just see that, oh, you've just gotten started, but then you never really maintained it. So I think it's better to start with something that you're going to be interested in and can potentially be committed to. Now, I want to get into some of the challenges of social media use, and these are a lot of the pitfalls that I think you may or may not be aware of. I don't want this list to be something that deters anyone from using social media, but just something to be aware of, because it's not, while it can be scary, I think that just being aware of it, and when you approaching social media with this understanding, is already, is really what's most important. So first and foremost is protecting patient privacy and HIPAA. I think that that's one of, obviously one of the most basic, most important tenets of what it, of being practicing medicine. So I think that, when you go on social media, no matter what platform it is, you often see people talking about medicine, talking about interesting cases, despite not putting patient names or photos on there. Sometimes patients can be easily identified based on the information that's putting out there. So if you put yourself in the shoes of a patient and kind of ask yourself, okay, based on this, would I be comfortable seeing this? And if I were a family member of a patient, if I saw this and I could identify the patient, is that, can I identify a patient from that type of information? That's always the approach that I take, is putting myself in the shoes of the patient. Next, avoiding individualized medical advice. I get plenty of messages on the daily asking me, telling me about their symptoms. Sometimes I get sent entire PDFs of medical records. And bottom line is, I cannot give medical advice over the internet. And I tell them universally that this would be doing them a disservice, because I don't have access to all the necessary information, and it simply because I'm not examining the patient in person. So I would always redirect patients to really consult their own medical providers for their individualized advice. There are some other gray areas that are not as well defined, like sponsored content and conflicts of interest. This has really been highlighted over the years with the rise of influencer culture and industry kind of reaching out to health professionals to promote certain products or to sponsor certain posts. And especially when we're talking about interesting cases from my field, being a very procedural field, I want to be very clear about any sort of potential conflict of interest. So if I'm talking about a cool procedure, if it's off-label, I say it's off-label. If it's talking about a specific device, I make sure that I state any conflict of interest if there is any. And that's not universally done, and there isn't any law or regulation behind that that requires anyone to do that. But I think that it's, for the sake of our patients and for the sake of transparency, I think it's best to keep that in mind. Professionalism concerns, especially on certain platforms like TikTok, where there's a lot of humor. We've seen a lot of health professionals come under fire for kind of making patients the butt of the joke. And so we really want to make sure that we're not creating humor at the expense of our patients or our colleagues, or doing anything that can potentially be perceived as unprofessional. Misrepresentation, misleading the public, part of what drove me towards this, right? This entire mission to try to combat misinformation online is the fact that there are folks out there who are, giving out health advice without being trained. And I think even within the medical profession, we should be careful about some of the topics that we talk about. And I had an internal struggle a little bit throughout the pandemic talking about COVID, because at a certain point I felt that there are certain questions that really should be directed toward virologists or immunologists rather than me. So I think that even then, I think that we do have a public health responsibility, but we also have our limitations, and we should really direct people to the most accurate source of information that you can possibly direct them to. And finally, the last couple of pitfalls I want to go through are kind of related to us as creators. The psychological strain of being on social media, even without being an active creator on social media, we've probably all heard of the psychological strain of comparison and what social media can potentially do to your psyche. And we need to be aware of that even more so, because I often give the example that if my content doesn't perform well on social media, I don't want to internalize that and make it seem that that's somehow people not liking me as a person. And I need to separate that sometimes. The consistency of being on social media and the time commitment is a very real challenge, which is why I think incentivizing its use in the future is going to be important to encouraging more health professionals to be on social media. And finally, personal safety and well-being. Once you amass a following, your personal safety is something that you have to think about, because I've had colleagues that have been stalked online who have had their photos kind of reused and reposted elsewhere and used to scam others and things like that you would never think of until you're in that position. And similarly, when we're talking about very potentially polarizing topics like vaccines, I've been baited into conversations and had my responses displayed in anti-vaccine groups. And those are things that I think about now whenever I'm talking about these subjects. And it doesn't deter me from posting about that, but it makes me think about how I'm constructing the message so as not to be as inflammatory. And there are resources out there for people, for if you do come under attack like this. There are organizations out there that can help. So not to worry that there are structured resources out there. For every field out there, GI and otherwise, there are likely existing publications that kind of can give you an overview of social media so that you don't have to remember everything that I say today. And so you can refer to those. And I've certainly written some of them specific to GI, but a lot of it is generalizable to other fields as well. And a final plug for the Association for Healthcare Social Media. Like I said, it's a society that I created with my colleagues on social media. It's the first professional society because we felt like it was important to have representation like other kind of medical subspecialties, because ultimately we want to have a organization that can be a resource to not only health professionals, but also to institutions as well. We had an annual meeting last year with a lecture series and an abstract submission. We actually have a collaboration with Cochrane, and they've provided a grant for social media research, which we're in the process of vetting some applications. We have formal partnerships with YouTube, LinkedIn, Pinterest, and they've been very helpful in providing us resources and kind of ways to optimize our presence on those platforms to, to convey health messaging. And they all recognize the importance of health professionals on their platforms as a result of the pandemic. So, so hopefully this will only grow from here. So a couple take-home points, because I know that we're running out of time. The number one use of social media in 2021 is staying up to date with information. So, it's no longer just for fun. I think patients and the general public are out there being exposed to, they want to learn, and health topics and health knowledge are, a part of all of that. Social media can therefore impact public health messaging as well. I don't think I need to really belabor that point, given everything that's happened over the past year. And social media use by health professionals may redirect the public to more accurate sources of medical information and help humanize the profession, especially because trust in our profession is so low at this point. And finally, social media may be helpful in assessing patient behavior and activity. So there's only more and more research each year, and hopefully this will help us, actively treat our patients as well and address their concerns and improve their outcomes. So hopefully there will be more research on that in the future. And finally, I always love to close with this cartoon from The New Yorker. It really sums up my life, essentially, in one comic. Bile exits the gallbladder, passes through the cystic duct, gets released into the intestines, and ultimately winds up on the internet. And when I saw this, I mean, there isn't a more perfect summary of me as a person. And, the fact that I'm on social media only means that I'm accessible, very easily accessible. So please reach out to me if you have any questions. If you want to get started on social media and have questions or concerns, feel free to reach out to me on any platform. I'd be happy to help. And thanks again for having me. It's really an honor to be here. And